Great. We are live.
Last drink of coffee.
Yeah, so welcome everybody. We are live here with Lieutenant Governor Bethany Hall-Long from Delaware. Today is Monday, March 30th. Happy Monday. Every day is a Monday or a Saturday, depending on what day of the week it is. But yeah, well, welcome. So
thank you for having me. It's a delight to be here.
Yeah, do you want to, well, I want to start off just by saying that, because I know you're from Sussex County, or you grew up in Sussex County, and there was a Shark Tank episode just on Friday. And Katie Jo Evans, who runs Frozen Farmer out of Evans Farm down in Bridgeville, was the featured, one of the featured shark guests, and got a deal. So
I thought that was great. If anybody's been to Bridgeville, they've got that incredible corn maze that they have for families, and the Evans Farm provide a great resource, like all farmers in our state. And it was awesome. It was great to see that happen, and with her frozen sorbet, and everything's grown Delaware farm based, which is so important. So as a farm girl from Sussex, who actually yesterday was on the farm visiting my mom, and was out with over 60 cows and donkeys and other things, animals. When folks called me, they were like, what is that noise in the background? So I was out keeping my social distance in the open air, away from everybody. And again, congrats to the Evans Farm family.
Yeah. So I know you guys are doing a lot with the COVID crisis, with the census. Do you want to just talk what's going on right now that the MILLSUMMIT community, the Delaware community, should be aware about?
I think for the Mill community, first and foremost, thank you so much, Charlie, to you and the team there, and all the bright minds that come together through the Mill and the Millennial Summit, and the work that the entrepreneurs do. I can't thank you enough. And I think it's kind of what we've all been doing, which is the main thing with the COVID. Again, I can take very specific questions. We know that Governor Carney keeps updating his executive orders. I know this morning there were some changes made for persons coming across the state lines. But I think the most important thing, we have to keep reiterating, and I know everybody's tired of hearing it, but is, really that social distancing, staying inside, staying home if you're sick. If your employer allows you to work from home, stay home and work. And again, just common sense measures, when you're out getting gas or having to get groceries, following those same instructions, and washing your hands and wiping off and sanitizing, really important. Can't emphasize that enough.
Yeah, no, it's definitely a new world everybody's getting used to. But before I forget, I do want to thank Capital One, who's our title sponsor for the MILLSUMMIT.
Oh, great.
And we've talked about in the past, we're definitely we are plugging away with the MILLSUMMIT and everything else. So, but today I want to talk a little bit about the COVID-19 crisis. And so what can you talk sort of briefly about what can the Delawareans really do to help each other right now in this moment?
I think that's an absolute awesome question, particularly from the Mill and the Summit there where you are. And, Capital One is a sponsor, and other sponsors. I think really continuing how you can help is if you are a small business owner, or if you're part of the corporate world, really relaying the importance of the message. I know at first people thought, I could go to the beach, or I can hang out and do a housewarming party. Those things really do matter. And when Governor Carney issued, that people stay home who can stay home, that was important. And we've watched over the weeks as we've seen some changes occur. Speaking to you not only as a lieutenant governor, but as a public health professor at University of Delaware in nursing for 24.
Yep. I think we
in your community, if you are able to, as business owners and small business communities, contribute and make a difference, not only in keeping people calm and keeping people practicing the good hygiene, but really also finding out how you can participate with the nonprofits. I know many of you participate, or either employed, or you yourselves are volunteers. They're struggling right now. And so it's really important. We love the nonprofit community. They fill in and do wonderful work for our state agencies. And I believe in my heart that those of you who are listening today really can help make a difference, whether it's in your time. I know you're going to be at home, but they have call centers. They are requesting funds. They are delivering food. They are helping many who are providing still essential childcare or other services. And later on, I'm sure we'll have the opportunity to maybe delve in a little bit more about some of the orders that the governor has put in place, but also surrounding some of those resources that were part of the governor's order, whether it be from the small business loan side to the housing assistance. And then also, we're not in this alone. This is not a government solution. We have to have the community, but we're also not just state-based. We know that federal government has come around. We had the signing of the Relief Act, and we also rely very heavily on our local jurisdictions. Many of us who are in a town or in a city or in a county, we very much have to all work together, all hands on deck.
Yeah, definitely. And I think we're having a little bit of some sound echoes here. So sorry about that. But yeah, no, it's definitely. Well, I know we've had DCF and United Way. They're certainly leading the charge along with Dana and Philanthropy Delaware on the crisis relief funds. I know they've been raising a lot of money, particularly for the frontline nonprofits that are really
right. And I think you had them on, right? You had Cynthia and Sheila and them on. That was great. Yes.
So what about how's your office helping with the current pandemic?
Well, I think like all elected officials, whether our legislators, whether it's our city council, our town councils, our executive, county execs, to our statewide other electeds, I think each one of us are fielding a lot of questions. We have a lot of individuals who are out of work, so we're directing them to the unemployment assistance. We're directing folks who need vouchers for housing or assistance, to put food on their table. I also have some very specific responsibilities chairing the Behavioral Health Consortium, working really hard. And I know you've had Dr. Megan Walls on before, addressing anxiety and things we can do around our mental health. But my office has had a lot of phone calls and a lot of referrals in the behavioral health lane. In addition, my office has worked really hard with not only a number of the entrepreneurs and small business owners who've contacted us to get that assistance, but we've also spent a great deal of time out helping individuals. I'll actually grab for you where I was before I came in. I don't know if you can see, probably not, but you might be able to see. My nose is turning red. You see the other professionals on television. I was just out. I had my N95, my protective gear on, and as a professor of nursing, it is essential right now that I participate and do my part and lead in the community. And so my office, I have been out on the street, certainly in protective gear, not violating the governor's order, but as an essential health provider. And we've been working hard to identify at-risk individuals. My particular role has been around the homeless, but also coordinating services with nonprofit and the faith-based community. Again, not putting myself in jeopardy. And that's why we want persons to stay home, only go out as you absolutely have to. And when you do, wear protective measures or use protective precautions. Certainly my office, like other elected officials, runs nonstop. I have my phone with me all the time. My staff certainly are working remotely. But for those who call my office, they're getting answers. And that's what's happened with our government, whether it's our state service centers or our different programs. We've really cut back to make sure that people can get their DMV processes done remotely. And for those who don't have access to computers, we've certainly been working really hard to make sure that they are cared for. So again, a lot is occurring. And to me, my vulnerable groups, homeless, veterans, and senior citizens, are top priority of my office right now, along with your listening audience, which is our small business owners, making sure that they are viable and have the resources they need for their business.
Right. No, it's definitely, we definitely need the frontline government and the first responders and the medical professionals and the police and firefighters really staying healthy as best they can. Yep. What you mentioned, we talked a little bit about the computer stuff. There's a lot of educators, there's a lot of teachers that are, that have students who don't have access to computers and the internet. What are some ways that you guys are trying to address that issue? Because it's really become exacerbated nowadays.
Right. And I know in the governor's office, John Chan and our secretary Bunting have put a lot of effort working with each of the districts. So again, each of the districts kind of have a little bit unique processes, but everyone should still have access to their lesson plans, whether via the internet. And those communities where individuals don't have access, one of which is my nephew, who is a freshman in high school now, who doesn't have access to broadband, and believe it or not, only has like an iPhone, and it doesn't work half the time because they don't have good access. They have worked hard to make sure that there are hard copy lesson plans. The challenge we run into, and something I've seen as I go door to door in our hotels where we have some homeless families, we have to really work hard to make sure that the school districts have that phone number, a phone where they can reach a parent to ensure that those children have those plans. And so, again, we're working hard to make sure more computers are in place. Our director of the Division of Technology here, James Collins, has really done a yeoman's job of working with Department of Ed and really working hard to make sure teachers and students have that technology access. Because again, many of them went to our public libraries, and we know for public safety, our libraries have been closed in many areas. And so without that service, we have to make sure we provide for our kids.
Yeah, I know Groups was also on Shark Tank earlier in the year. They've really been pushing, trying to get laptops in the hands of the students who need them. So there's a lot of all hands, on both public, private, and government, all working through this. What changes would you say businesses? I know there's a lot of legislation going on, but in terms of just maintaining the economy while social distancing, are there things that the businesses should be thinking about doing or could be doing, or other resources that they have available to them right now?
Businesses have really stepped up. I mean, certainly some businesses I know are going to take it a lot harder in the pocketbook. And, that's why I hope many of them look at what funds are available through our governor's executive order with the HELP program and others with low interest loans, turning to grants. Certainly, I'm not going to go into listing everything that our congressional delegation was very supportive of that got passed at the federal level. But, making sure that they stay operational. For those who can stay operational, there are different funding incentives to not lay off employees. But I think the things that they're doing, many are stepping up and are actually volunteering. We saw downstate with Dogfish is starting to make hand sanitizer, and we see a lot of innovators. And I know who's listening today are innovators and entrepreneurs and really smart people who are seeing this not really as a lemon, but a lemonade. And many of them are changing focus for now and are providing additional services outside their usual lane. Some who are doing this as a donation, some who are applying to be a vendor and actually get compensated with some of their innovation. And so to small businesses, I say hats off. I know it's been difficult, particularly for our food industry and to our bars and our restaurants. I know I try every day to go to a different place and do carry out, for my family, for those restaurants that are struggling, statewide. And so hopefully that's something other businesses can do, perhaps, you think about that and having something delivered to your home. Some businesses, as a way to reward their socially isolated employees, are having food delivered to their employees' homes. So we don't have a lot of people going out, but it's a nice thank you, and they're letting their employees know. The other thing that, employers are doing is certainly contacting us with questions, important questions, because it's important that people have still access to not only a paycheck, but their health care. And so again, making sure if you aren't able to sustain your operations, working with our government to make sure we have those transitional plans in place. And so I know our Department of Labor, our small business groups, and our entrepreneurs, like many of you, have really tried to think out of those lanes and stay sustainable. And let's all hope after May 15th or the end of May that we can look back through this and wipe off our brow and say that we made it through the pandemic.
What would you say is the most positive news you've heard in the last 24 hours? And I want to get to the census, but just in terms of...
Yeah, we actually have... I am one who always sees the glass as half full and not half empty. And so that's kind of a tricky question. I could answer in many, many hats. From from the large level, government level, and from as a professor of nursing and as a head of the Delaware Medical Reserve Corps through the University of Delaware, which is volunteers. I am hopeful because I see a large number of volunteers and individuals stepping up and willing to volunteer, individuals who are providing resources. And I have to say, I feel confident with the plan that Governor Carney, where he has appointed A.J. Shaw in our DEMA agency, Department of Emergency Management, and Dr. Carol Rattay, the Division of Public Health. They've been hard at work, since the end of December. This started in China around December 11th, and we have been planning and working hard with our hospital systems. And what encourages me is that the government is not tasked to do this alone. We have folks like those listening today who have put their hands on the deck with us in our business community and in our hospitals and nonprofit community. And I have to give a huge shout out to the many nonprofits who have stepped up and are providing essential services, transporting persons, providing food, the 211, answering calls. And so I get hope. And a small example, I just got a text before we started the program today, the podcast, where I had 30,000 masks and some gloves delivered through some of the Christina School District nurses who are collecting the items for us. And I think it's that goodwill that I'm seeing in the state that gives me tremendous hope. And coming off the streets today where I was working, screening some of the homeless, I had a lot of hope as I see the care that's being delivered and the places that people are being placed, that we're going to be okay. And as long as people listen and socially isolate, work to keep good hygiene. And if you're sick, before you rush to the emergency room, really make sure you have that fever that's been a while, that you really are having breathing problems. So again, we don't want to overcrowd our emergency rooms with worried well. So again, using those common sense measures gives me hope.
Well, I know, if setting the pandemic aside, the census would have been much more front and center right now, but it's still taking place starting this week or
tomorrow, yes. We have all kinds of information of what it impacts. I mean, it is everywhere. I've been so fortunate when Governor Carney had me take over the complete count to have excellent partners with all of our government agencies, the community. We're working really hard with the nonprofits, the philanthropic foundations. I know you've had Sheila and Cynthia and others on where we're really working hard. And so we have ambassadors who right now have been brought on to address those hard to reach populations, individuals perhaps who've been homeless or homebound seniors or veterans who maybe wouldn't get a response, or individuals just out of incarceration. And so we've got individuals in the queue who are ready to hit the streets once the coronavirus goes away. And we've had a little extension through July. April 1st, this week, you'll see me do my census online, but it's easy, it's quick. It literally takes less than 10 minutes. And I guarantee you, for those of you listening and watching today, you are very bright, very smart. I think you'll probably be done in less than 5 minutes. It's important. And why? It addresses everything that the Mill and the Millennium Summit and all of you stand for. It addresses the funding that has to come to Delaware, billions of dollars, if we don't do it. And we could, if we went over $1 million, be on the queue for a possible another member of Congress. Certainly the numbers are down right now for those who have completed their census, not only here in the state, but nationally, because we've been in the midst of the coronavirus. You should have received mail at home with a unique identifier. There's a phone number. You can pick up the phone and call. You can go on your phone. You can do the app. You can do the computer. Answer those questions. It will help us in Delaware. It determines small business owners. It determines our amount of money. We were just talking about Shark Tank, one of your members, the agriculture program. It affects our school lunch program, those who get feeding, those who get the business line. I could go on and on and on why we need to do the census. It is the basis for data that are used in almost every report. Most of you in the millennials and the Mill know that those data, when you put in a proposal, that you have to have data on the size of the city or your economy. All those data points come from our demography that's collected in the census. So important. So something you can do while you're bored at home, do the census.
We talked about the homeless population earlier. What are ways that the census is going to really try and count the homeless and the other hard to reach populations, particularly in Sussex County, where it's a large migrant and immigrant population?
Yeah, right. We want people to know it's safe. Thank you for bringing that up. It's really important that it's safe and it's private. And when we've been out with our wonderful partners that we've been able through the leadership in the General Assembly this year, they were great leaders to us. And they helped provide funding, which our governor signed off on. And by doing so, it's the first time ever that we in Delaware, in addition to our federal ambassadors, which are individuals who come from these communities that look like the community, that have the language of the community. And by the way, we have interpreters in like 90 languages. We are able to hopefully make that quick connection that, hey, your information is totally private. That is not being shared. You do not have to be a citizen. And we need every single child counted, every adult counted in the household, because that dollar figure, every individual is like $2,400. So you do the math. That's a lot of math when you have like 1 million people in our state. Yet we have a lot of individuals who were fearful, as you indicated. So again, by having these ambassadors out, and we will have many right now who are in the virtual world, but we have them in the city of Wilmington, leadership through Newcastle County, where Jess and the county has really stepped up working with the county exec and council. And then also in Kent and Sussex County, First State Community Action. Who doesn't love Bernice Edwards? And she and her team are working hard with the Dana organization through Sheila and others to make sure we've got people from Sussex who know the area working. And so they're on the phones now, they're doing virtual activities. When they can get back, boots on the ground, I know when they open the door to those who haven't completed, people are going to feel comfortable. So we're working really hard. But I know that I'm talking to some very bright, motivated individuals. If you have thoughts, perhaps, that you don't see on our census website that you think you can help us with, we will take all your ideas. So I appreciate that question.
Yeah. What about, I've seen a lot of info about when everything begins, the April 1st. When does it end?
That is the magic question. It's kind of like the COVID question, like coronavirus. Nobody knows when it ends. Well, they've given us a temporary date, like in the middle of July. But I think they're willing to be flexible based upon the numbers. And as you can imagine, the data are coming in lower. When Baltimore got their numbers in last week, they were significantly lower because people just have been, I think, fearful and paying attention to the coronavirus. So our hope is that Delaware, once again, is going to be a leader in the country. And given that we have had leaders in both our Senate and House, as well as the state level and county and local government, that this time we will show that we can get it done. And so I'm really hopeful, really hopeful that by July, we have topped our goal of over 80% of persons. In the last decennial, we were below 80%. I know 80% doesn't sound perfect to many, but when you're collecting data on personal information and private information, if you can hit that 80% mark, you've done really well. And that's our goal.
So with unemployment at sort of historic levels right now, is it too late to sign up to become a census worker? Or
no, you can still sign up. I know that the federal government here in the city of Wilmington, there's an office. You can certainly talk to look at our website. I know that those across our state are willing and happy to hire folks. So not too late to sign up as a census worker.
How do you, like, there's a lot, we talked a little bit, a lot of phobias. How do you get more young people involved in getting the census done? What are some tips or suggestions that the young professional community can be doing?
Yeah, and I think in the young professional community, there's some tips to entice them to get this done. As we mentioned earlier, I mean, really everything that you're going to be doing in your practice, many of you who work in the nonprofit world, we need the census done because a lot of the data that are provided go back to the direct dollars, the dollars that are transferred that government uses to fund and to work with and partner with nonprofits. Those of you who are in the young age who are getting out of college, you're going to start your businesses, as I indicated earlier, the data that you're going to use for a lot of your grant applications, if you're applying, a lot of times they're going to ask you, well, how many individuals are under the age of 18, or how many persons are 24 to 35, or they'll ask about the economics in the city or the town. you rely on accurate census data. So we need those data points. Also, some of you who are more recently out of college, or applying to college or going on to grad school, they have Pell Grants. This is just one example. Educational scholarships, educational grant programs, very important. And also to housing in the community and many of the social justice programs with our corrections, our prison, our environmental programs rely on data that are collected through the census. So I hope that helps.
Yeah, definitely. I want to turn back to COVID. I know we have only a few minutes left, so if people have questions, they can still ask them in the comments.
And if not, I have a couple things I can share with you, other things that are happening in the Lieutenant Governor's office. Should we not have many questions?
Yeah, talk about that real quick. So we got a couple minutes.
Yeah, we have a couple. Here we continue to work with mental health and substance use issues. We are very focused, rightfully so, on keeping Delaware safe. We are working hard on the overdose data. I know a lot of us who work in the millennial area perhaps might know someone who's suffering from depression and anxiety. We want people to know it's okay not to be okay, particularly now during these times. And sometimes right under our noses, we have a colleague or a friend that might be addicted or using Percocet or heroin or fentanyl, and we don't even know. And so we want individuals to know it's okay to call in. So again, if you're just anxious sitting at home, I know Dr. Megan Wall gave you some help what you could do and structure. But we also just want you to know that there is support, and we're working hard on that. I want to remind individuals, we've had, unfortunately, 6 deaths with COVID, and we've had, today over 230 some, cases. The numbers are going to go up with testing. But I want to remind you, we continue a very sobering statistic. We lose a Delawarean every 22 hours, and that has continued and not decreased. And we're working hard. Every 22 hours, somebody dies from fentanyl and overdose in our state. So think about that number. In the month of December, we lost 50 Delawareans to fentanyl overdoses. So I want people to know we've got a serious problem while we're still working with COVID. But if you've got friends or others that need resources, please get up with our office. That number would be higher if we had not had the excellent work of the Behavioral Health Consortium Task Force and the members and the work they've done. I can't even imagine with the silos that we've broken down across state agencies, how high that number actually would be. And so again, to those of you listening today, thank you for doing your part. Thank you for helping us with that. And on a positive note, we continue the Lieutenant Governor's Challenge 2.0. Many of you have participated. Some of you have been winners and role models. And that is blending physical well-being, mindfulness, yoga, things that you're doing with your employees. Now we're doing them at YouTube and over the internet. But however you're doing it, thank you for participating in the Lieutenant Governor's Challenge 2.0.
Yeah.
And thank you to nurses and doctors out there who are on the front line. I want to say thank you to them and my first responders.
Yes, definitely. Thank you. So we only have about a minute or so left. What would be your sort of, if somebody was listening and they were concerned about the COVID pandemic, or they're concerned about the census, can you give sort of 2 or 3, notes of reassurance on those?
Yeah, absolutely. For the census, we want you, number one, to fill the census out and go online and get your unique identifier. We also know if you have questions with public health, we want you to call 1-866-408-1899. I want to say that one more time, 1-866-408-1899. And we want you to also go to the census to bring money, to bring it back to your business. So, and sign up for the Lieutenant Governor's Challenge 2.0, but be hopeful. I'm very much at ease with where we are, the leadership that our governor, DEMA, and DPH is showing, and what I'm seeing on the ground, and the hard work of the many leaders in our hospital systems, and to the nurses, doctor, respiratory therapists, the custodians, and all those others essential services at the grocery store, at the pharmacy, just thank people. And when you get a chance, have food delivered to your house or to your employees to keep our restaurant economy going.
Yeah, well, definitely. Those are all great points, and we appreciate all the work your office and you are doing. And
thank you.
And definitely thank you very much for taking the time this afternoon. So
thank you. Have a great one. Call my office if you need anything. Okay, thanks.
We'll thank our sponsor. We talked a little bit about the the DCF and United Way, and also Capital One. And thanks for watching.
All right. Thank you.
Thank you. All right.